This is being recorded by camera. Come in. Closing door, providing privacy. Washing hands. Hi, I'm Emily. I'm going to be your nurse today. How are you doing?
Good.
Do you have any pain or allergies?
No.
I'm going to check your ID for your name. Can you give me your name and birthday?
Yes. Dear Rayner.
And your birthday?
6/13/91.
And do you know why you're here today?
Yes, for checkup.
And what's today?
Today is Tuesday,
And the year?
2015.
Good. Patient is alert and oriented ×3. The speech is clear and goal-directed. There's no body odors. Their grooming is appropriate, and she's wearing appropriate weather clothes for the weather, and she is happy, and her affect is appropriate for the situation. I'm going to go on to the skin. I'm going to palpate. It is warm and dry. It is appropriate for ethnicity, and there are no scarring or lesions. Could I have you take off your glasses? Thank you. Eyes are, conjunctiva is pink, sclera is white, the pupils are round. I'm going to now do the pupillary light reflex. Could you look at me? And follow my pen. Pupils are 3 millimeters, reactive to light and accommodating. I'm now going to look in your mouth. Say ah. Uvula, it rises. Tonsils are 2+ bilateral. The oral mucosa is pink. The tongue is pink and moist. Gums are pink, moist, and there is no edema. Teeth are white. Some caries noted, and that's it. I'm now going to go to your, could you smile for me? Brown, puff out your cheeks. Cranial nerves 5 and 7 are intact and active. The neck has no scarring or lesions, symmetric, and color is appropriate for ethnicity, and it is warm and dry. I'm now going to palpate for the carotid artery. The carotid artery is 2+ bilaterally, and now I'm going to auscultate your carotid artery. Could you take a deep breath in for me and hold it? And release. And one more. Good. No bruise noted. I'm now going to, if you could put your glasses back on, I'm going to now inspect your upper extremities. Temperature is warm and dry. Color is appropriate for ethnicity. There is no scarring or lesions. I'm going to do your brachial arteries. Brachial arteries is 2+ bilaterally. And now your radial is 2+ bilaterally. Could you squeeze my fingers? Strength is equal in both arms. Could you go like this for me? There is no clubbing noted. Going to check your capillary refill. Capillary refill is less than 3 seconds. I'm now going to listen to your heart, beginning at the aortic, which is at the second intercostal space on the right sternal border. Then at the pulmonic at the left sternal border at the second intercostal space. Herbs at the third intercostal space at the left sternal border. The tricuspid at the fourth intercostal space, left sternal border, and the mitral at the fifth intercostal space, midclavicular line. And I'm going to stay here for 60 seconds and listen for the apical pulse. And then I'm going to switch to my bell and go back at the mitral, tricuspid, herbs, pulmonic, and the aortic. Okay. S2 sounds are heard loudest at the base, and S1 sounds are heard loudest at the apex. I'm now going to listen to your lungs on the anterior side. When I move my stethoscope, would you take a deep breath in? There are no adventitious sounds and vesicular sounds noted. I'm now going to listen to it on your lateral side. Could you please lift your arm up? On the other side. No adventitious sounds noted. And then could I have you stand up for me? Perfect. I'm actually going to have you stand like this. And could you take a deep breath in? And please let me know if you get lightheaded. No adventitious sounds and no vesicular sounds noted. I'm now going to do your anterior posterior diameter. Anterior is 2 to 1. I'm going to have you bend forward and touch your toes for me. No abnormal curvature noted. Could you please stand up for me and turn to the side? I'm now going to percuss the costovertebral angle. Is there any tenderness?
No. No.
Good. I'm now going to have you sit back down. And I'm going to have you lay down for me. Okay, there is no scarring or lesions on the abdomen. Contour is flat. I'm now going to auscultate starting in the right lower quadrant. Vowel sounds are present and active in all 4 quadrants. I'm now going to palpate. No mass is noted. I'm going to percuss. Dull sounds heard over organs and hollow sounds heard over bowel. In the right lower quadrant, there is the cecum and the appendix. In the right upper quadrant is the liver and gallbladder. In the left upper quadrant is the stomach and spleen, and in the left lower quadrant is the descending colon and the sigmoid colon. Could I have you sit up for me? No JVD noted. And I'm now going to do your lower extremities. I'm going to feel your legs. The temperature is cool or warm and dry. No edema noted. There is no lesions or scarring on the lower extremity, and it is appropriate for ethnicity. And now I'm going to get your popliteal pulse, which is 2 plus bilaterally. And then I'm going to have your tibial pulse is 2 plus bilaterally. And can I have you take off your shoes? I'm looking for her dorsipedi pulse, which is 1 plus bilaterally. Now I'm going to do the Babinski test. Babinski test is negative. You can put your shoes back on. I'm now going to have you stand with your eyes closed for 30 seconds. I'll be here in case you fall. Romberg test is negative. And then can I have you walk straight to the wall and back? Gait is natural, no assistance needed, posture is straight, and